I know you did mention earlier on as well that I know that someone like yourself would have meticulously prepared before reopening, but you said you've made some changes to some of the things that you felt that you were going to do in terms of policies or procedures. Could you explain what those are?
Well, thanks for the tip. We did, I've forgotten her name, Joy, she called Jenny.
Oh, yes, Jenny, yes.
We all did a day training on
yes.
an international infection control, and that was very good. And what that really taught us more than anything was get it written down. And, you know, we're great ones, Steve and I, for spreadsheets. Not everybody likes a spreadsheet, but we love a spreadsheet. And at least you've got all the editing history, when you first put that, when you changed it to make it more important. But the main things were we risk assessed the building on a walkthrough. Then we risk assessed every treatment on a treatment roll through, you know, so all the treatments were performed from 16th of June to 4th of July in-house, closed, so that we could spot anything. So of course many things were removed from the clinic in terms of clutter, in terms of advertising, in terms of things that we didn't think should be washed anymore. So the consumables bill has gone up, but some of the treatments we decided not to do until COVID was less in the community or there was a vaccine available. Certainly, because I employ advanced skin and laser therapists, I reviewed all the patients coming back in, whether they were known to us or not known to us, on a case-by-case basis. So everybody who came through was checked by a nurse, that being me, to see if there was a medical or psychosocial need. We're still doing that, and we will be doing that going forward. It's tiny bit heavy, but at the same time it feels good. The patients like it, the staff like it, and I think setting out on the nurse treatment plan that can still be adjusted as time goes on is a very good thing. Is that sort of what you meant, Ron?
Yeah, really. I mean, I think obviously with this, I think everyone is still learning as they go forward, and you know, it's okay anticipating this and putting systems in place. But as you and I know, unless you really audit those to see whether or not they are working as effective as they could be, then you know. We've
audited already. The first audit date was 6th of August, but I couldn't wait that long. And I'm not in charge of auditing. I've actually given that to 3 people other than me. So I wrote the policies, and they are in charge of health and safety and COVID auditing. Yeah. But you know, we had things like the refusal of one person not to bring a bag in, and you know, the refusal to, you know, they want to bring in a big handful of keys, several devices, and wet wipes and sanitizing and whatever. So we didn't think that somebody would be non-compliant. So that's gone on the audit. So as a result of auditing early, so this is a result of auditing 250 patients in 11 days.
Wow.
Yeah, so, you know, we've got like a plastic box, you know, so they can put stuff in a white see-through bag, transparent see-through bag. I know some people had the foresight to do that already, but we thought people would be compliant. They're not all compliant. Things like doing this on our, you know, they're about to pay. We try to take prepayment now, which I think is helpful for business. But if for some reason or not, they don't want to pay until they're in the clinic, you know, one person, you know, took her sunglasses off and put them right by the card machine. And you know, I think they ought to watch Contagion. That might be the easiest thing for them to know about cross-infection. You know, you can't put something that's been on your face down somewhere else that somewhere else is going to work.
Yeah.
So that's a bit uncomfortable to do something like to the patient, I'm sorry, I've got to clean this immediately. Will you put your glasses back on?
Yeah.
Somebody questioned me on this, not a patient, but a team member. Like, could you not just do it when they've gone? And I remember during my training, it was about talking about being candid. In healthcare, you need to be candid. Please don't put your glasses down there because we now have to clean it.
Yeah.
Please don't come with makeup on because we have to watch out for aerosols when you're washing your face in the bathroom, then wash the bathroom or sanitize the bathroom, then come in for treatment.
Yeah. So
my feeling is that healthcare professionals are pretty good at being candid. Healthcare assistants and people who are allied to us are less good at being candid.
Yeah.
And that's all down to training, and we can train and qualification. You need to sort of like say, does it hurt as a nurse, or tell me where it hurts, or not really, I'm sorry I've hurt you. Yeah. Or this is going to hurt. I think that's the book title, isn't it?
That's
but,
it.
we're used to being candid. So what else did we have? We had people touching their mouth like this and then putting their hands on the desk. And it's just, I think I mentioned to you in my email to you that I'd like to be able to teach in a nurse way, particularly the ones who trust and know me, to say, now we're going to wash our hands again, or now we're going to sanitize our hands again. And the other thing that's been a bit difficult for nervous people is not being able to bring anybody in. But I've had to stick to that. Yes. Well, one, because it's there for a reason. And, we just talked about being candid. It's there to prevent extra risk of infection. Mm-hmm. But of course, it's difficult for the anxious patients because they might want their mum, their husband, their boyfriend in. Yeah. And if I set an example of allowing one in every now and again, then my team won't follow me in the way that I want them to follow me. The way that I want them to follow me is cross-infection management control. Cross-infection control is you don't break the rules.
Yeah.
You absolutely don't break the rules. And we talked about masks earlier on in the week. I think I told you I've worn a mask since getting home from Colombia. I was in Colombia at the beginning of lockdown on holiday. So I spent the first part of lockdown in Colombia. So when I got back, as soon as I got back, I immediately started to wear a mask to go shopping. I didn't do much shopping. As soon as I could get online, I did a lot of that. I was out on my own doing my exercise, and also I feel that wearing a mask is an outward sign to others. Remember, we're in a pandemic. It's also an outward sign to you. Oops, don't touch your face. There's a mask there. It's a physical barrier. And I think when patients come in, as a nurse activist, as a bossy old cow, I'd like to be able to sort of like say, get your masks now. It's only a surgical mask, but get your masks fitting nicely now. Bend the wire around your nose, put your glasses on over the top of it, and spread it to under your chin. That's it. No need to touch now.
Yeah.
And we're sitting from our patients at 2 meters social distance and only approach them when we've got full PPE on. Yeah. Full PPE. It's a plastic apron, it's gloves, it's a mask, and it's a visor.
Okay, fine. So I think it's a really important point, because I think obviously the government's really dithered over this in terms of looking at masks, and you've had also in America as well, where I think, again, they've just done a U-turn, and where Donald Trump has just actually said, oh, maybe we should be wearing masks now, whatever. But I think there is a really important role there when you're looking at educating patients, when obviously you're coming from a medical perspective and really understanding how virus is transmitted and how you actually reduce the risk of transmission and the importance of some of these simple measures. So I kind of like what you did, with what you said you did during lockdown, around focusing on educating people around things like that to reduce and minimize transmission of virus, rather than just, kind of going out and going, oh, we've, can we get your Botox after lockdown or something, which a lot of people are doing.
I think it's also evidences sorry to blow my own trumpet, but it evidences how interested you are in community health or public health. You know, we aren't just a Botox and filler practice. We are a nursing care and health practice, nursing-led practice, and I'm interested in all aspects of health. And when the patient comes, it's not just about filling a face, it is about helping them to lose weight, it is about helping them to understand the importance of their gut microbiome. You know, if they've been on antibiotics for acne for years or whatever, it's all about those additional things.